This slide's presentation will guide you through the process of constructing a searchable clinical question. In Clinical Inquiry 1, we talked a little bit about the 5 steps of BBP, but we spent most of our time on step number 3, and that is appraising the quality of a research study. In Clinical Inquiry 2, this course, we're going to finish up the rest of these steps, and the first step that we're going to talk about is step number 1, and that's asking a searchable clinical question. Now, this step is really broken down into 2 parts. First, you need to identify a need for information and a patient that you need this information for. And next, you have to construct a focused, searchable clinical question. For this course, I'll be supplying you with a paper patient. The paper patient is going to be the kind of patient that you would ordinarily see at whatever clinical site you happen to be in for this rotation. We're going to use these paper patients to create our focused searchable clinical question. Specifically, I'd like you to generate an intervention type of question. So you're going to generate a question that is going to help you find information in the literature about how to intervene with this particular patient's problem or diagnosis. Now, there are really 2 kinds of questions that you can ask. The first kind of question is known as a background question. And a background question is just general information, maybe about a particular diagnosis. Let's say that you are unfamiliar with a diagnosis of a syringomyelia, for example. You might want to look in a textbook or some sort of reliable web source to just find some general information. Okay, this kind of question isn't a searchable clinical question because it's not specific to an individual patient. The kind of question that is going to be a searchable clinical question is known as a foreground question. And this is a searchable clinical question because it's specific to a patient that has a condition, and you're asking about a clinical outcome of interest for this particular patient. These kinds of questions are answered using a clinical trial or evidence-based clinical practice guidelines that we talked about previously. Searchable clinical questions usually contain 3 or 4 essential parts. These 3 or 4 essential parts can be remembered with the acronym PICO, P-I-C-O. P stands for patient characteristics. The patient characteristics include the most important patient characteristics that relate to the patient's health condition. The next step, I actually stands for intervention, but overall it's considered under the category of patient management. Now, patient management can include intervention, diagnosis, or prognosis, and it defines the component of interest for this particular patient's management. The study designs to answer these questions are going to differ, but specifying the component of your patient management, you can focus your question on a particular type of research study. And hopefully you remember that these intervention, diagnosis, and prognosis studies that we talked about appraising in Clinical Inquiry 1 are a little bit different as far as format and kinds of statistics that are used. The C stands for comparison. And the comparison in your PICO question is optional, but it's usually important for asking intervention questions. And O stands for your outcome of interest, which will help determine your patient's goals and identify an appropriate measurable outcome for your patient. The best way I can think of to walk you through the process of creating these clinical questions is to give you an example patient. And here your example patient is a 17-year-old swimmer, and she's referred to your clinic for neck pain. And the problem is that it's only 3 days before her state high school swimming championship, and she is scheduled to compete and really wants to compete, but is worried about doing so because of her neck pain. So the first kind of clinical question would be an intervention question. And I've created this table here and filled it in with the PICO elements. So P, patient characteristics, the characteristics that you know of. This is a 17-year-old female swimmer with neck pain. The intervention is manual therapy, and you want to know by comparison, is manual therapy more effective than straight therapeutic exercise? And the outcome of interest is going to be improving function and sports performance. So really, once you have all of these elements together, you can create your searchable question. An example of this question would be shown at the bottom of the table. For a 17-year-old female swimmer with neck pain, is manual therapy or therapeutic exercise more effective for improving function and sport performance? And again, this is an example of an intervention kind of question. You can use the same patient example to formulate a diagnosis clinical question. And again, the patient characteristics, 17-year-old female, and she has radiating neck pain. The patient management piece, or the I, is really a diagnosis. How sensitive and specific is the Sperling test for, and there's no comparison because it's a diagnosis question. The outcome of interest is going to be detecting cervical nerve root impingement. Again, the question, you put all the pieces together, is shown at the bottom of the table. For a 17-year-old female with radiating neck pain, how sensitive and specific is the Sperling test for detecting cervical nerve root impingement? And this is an example of a diagnosis clinical question. Lastly, we have an example using the same patient of a searchable clinical prognosis question. Patient characteristics here are competitive swimmer with recurrent neck pain, and the prognosis portion of the patient management is what is the likelihood that the athlete will develop. Again, there's no comparison because it's not an intervention question, and the outcome of interest would be chronic neck pain. Okay, again, depending on your patient and what information you are lacking, you will create one of these kinds of questions, whether it be intervention, diagnosis, or prognosis.